Good day everyone, I am Mariah Angela F. Pineda from BSN1. My task for today is to assess the body temperature of a patient. So the goal of this procedure is to establish baseline data for subsequent evaluation, to identify whether the core temperature is within normal range, to determine changes in the core temperature in response to specific therapies, to monitor clients at risk for imbalanced body temperature. And for the assessment, we have to assess clinical signs of fever, clinical signs of hypothermia, site and method most appropriate for measurement, and factors that may alter core body temperature. For the equipment, we will be needing different types of thermometer for the appropriate site to be used, disposable probe covers if available, and if not, we can use a cotton and alcohol as alternative in observing the proper hygiene for the thermometers. We will also be needing water-soluble lubricant for rectal temperature measurement, and non-sterile gloves if appropriate, tissue if needed, and pen and medical record of the client. So for assessment, we have to assess core tympanic membrane, check the patient's cognitive functioning, check the patient's rectal temperature, also check the most recent platelet count since the rectum was vascular and the thermometer may cause rectal bleeding. Then we also have to check the patient's axillary temperature and the temporal artery temperature. So, sir, can you please open your mouth? Alright. And then hold your arms against your body like this. Okay. And may I assess your ears and your head coverings? Is that alright?
Yes, ma'am.
Alright. Okay. Now, for implementation, we have to check the medical order or nursing care plan for frequency of measurement and route. More frequent temperature measurement may be appropriate based on nursing judgment. Then we have to bring necessary equipment to the bedside, stand, or overbed table. After that, we are going to introduce ourselves to the client, what we are going to do, why is it necessary, and how would the client cooperate. So, sir, I am Mariah Pineda, your student nurse for today. And I'm going to assess your body temperature, and you may cooperate with me by just following my instructions. Is that alright?
Yes, ma'am.
Okay. So we have to assess your body temperature through your ears, mouth, armpit, and through your rectum. Then we have to identify the patient's identity. So, sir, what is your name?
My name is Maverick S. Madiari.
And when is your birthday?
August 12, 2002.
And how old are you now?
19.
Alright. Then we have to perform hand hygiene and observe appropriate infection prevention control. After that, we're going to put on gloves if appropriate or indicated. Next, we have to provide client privacy. So, assuming that there are curtains, we have to close the curtains and close the door to room if possible. Then we have to select the appropriate site and the type of thermometer for the appropriate procedure. So, the first thing we have to assess is for the oral temperature. We have this thermometer, so we have to remove the electronic unit from the charging unit and remove the probe from within the recording unit. Then cover the thermometer probe with disposable probe and cover and slide it on until it snaps into place. So here. Then after that, place the probe beneath the patient's tongue in the posterior sublingual pocket. So, sir, may I place this, open your mouth. Alright. Then, ask the client to close his or her lips around the probe and continue to hold the probe until you hear a beep and note the temperature reading. Then remove the probe from the patient's mouth and dispose of the probe cover by holding the probe over an appropriate receptacle and pressing the probe release button. Then we have to disinfect the thermometer with the alcohol and cotton. Alright. Then return the thermometer probe to the storage place within the unit. We have to return the electronic unit to the charging unit if appropriate. Next, we're going to assess the auxiliary temperature of the patient. So, we have to move the patient's clothing to expose only the axilia. So, sir, may I lift your clothes? Alright. And after that, we're going to remove the probe from the recording unit of the electronic thermometer and place a disposable probe cover on by sliding it on and snapping it securely. Then after that, we have to place the end of the probe in the center of the axilia and have the patient bring the arm down and close to the body. So, sir, may I? Alright, very close. Then, we have to hold the probe in place until we hear the beep and then carefully remove the probe and note the temperature reading. Then again, we have to disinfect the thermometer. Right? And after that, we're going to cover the patient and help him or her to a position of comfort. Alright. Okay. Then dispose the probe cover by holding the probe over an appropriate waste receptacle and pushing the release button. Then place the bed in the lowest position and elevate rails as needed. Leave the patient clean and comfortable and return the electronic thermometer to the charging unit. After that, we proceed with measuring the tympanic membrane temperature. So, assuming that this is the thermometer for the tympanic membrane, if necessary, push the on and wait for the ready signal on the unit. Then, slide disposable cover onto the tympanic probe. Insert the probe snugly into the ear using gentle but firm pressure and angling the thermometer toward the patient's jawline and pull the pinna up and back to straighten the ear canal in an adult. So, sir, we have this. Right? Then activate the unit by pushing the trigger button. So the reading is immediate, usually 2 seconds, and we have to note the reading. Then discard the probe and cover in an appropriate receptacle by pushing the probe release button or use rim of cover to remove from probe. Then again, we have to disinfect with cotton and alcohol. Then after that, we have to return the thermometer and its charger if necessary. Now we proceed with assessing the temporal artery temperature. We have to first brush the patient's hair aside if it is covering the temporal artery area. So, there. Then we have to apply a probe cover. Then hold the thermometer like a remote with your thumb on the red on button. Then place the probe flush on the center of the forehead with the body of the instrument sideways and not straight up and down, so it is not in the patient's face. Then depress the on button and keep the button depressed throughout the measurement. Slowly slide the probe straight across the forehead and midline to the hairline. So the thermometer will click Fast clicking indicates a rise to a higher temperature, and slow clicking indicates that the instrument is still scanning, but not finding any higher temperature. Then brush hair aside if it is covering the ear, exposing the area of the neck under the earlobe. Then lift the probe from the forehead and touch on the neck just behind the earlobe, and the depression just below the mastoid. Then after that, release the button and read the thermometer measurement. Alright. Then hold the thermometer over a waste receptacle and then gently push the probe cover with your thumb against the proximal edge to dispose of probe cover. Instrument will automatically turn off in 30 seconds or press and release the power button. Going on with assessing the rectal temperature. Assuming that this is my patient, first we have to adjust the bed to a comfortable working height, usually below height of the caregiver. Then we have to assist the patient to a side-lying position and pull back the covers enough to expose only the buttocks. This one. Then we have to remove the rectal probe from within the recording unit of the electronic thermometer and cover the probe with a disposable probe cover and slide it into place until it snaps in place. Then we have to lubricate about one of the probes with a water-soluble lubricant. Assuming that this is a water-soluble lubricant, we have to put this on the thermometer. Then we have to reassure the patient and separate the buttocks until the anal sphincter is clearly visible. After that, insert the thermometer probe into the anus about 1.5 inches for an adult and 1 inches for a child. So, assuming that this is our patient, we have to insert it in the anus for 1.5 for an adult and 1 inches for a child. Then hold the probe in place until we hear a beep. Then carefully remove the probe and note the temperature reading on the display. After that, we're going to dispose the probe cover by holding the probe over an appropriate waste receptacle and pressing the release button. So we have to again disinfect the thermometer with alcohol and cotton. Okay. Then using the toilet tissue, we have to wipe the anus of any feces or excess lubricant. So here. Okay. Then again, dispose the toilet tissue and remove gloves and discard them. After that, we're going to cover the patient and help him or her to a position of comfort. Then place the bed in the lowest position, elevate rails as needed. Then return the thermometer to the charging unit. So for our evaluation, we have to compare the temperature measurement to baseline data, normal range for age of client, and client's previous temperatures. Analyze considering time of day and any additional influencing factors and other vital signs. So for the temperature of the patient, for oral temperature, sir, you got a 36.7 degrees Celsius. And for axillary temperature, you got 37.2 degrees Celsius. And for tympanic membrane, you got 36.7 degrees Celsius. So some nursing diagnoses may include ineffective health maintenance related to lack of knowledge of dangers of dehydration, risk for deficient fluid volume related to 12-hour daily work in intense heat, and potential collaborative problems including risk for complications of shock syndrome, risk for complications of tachycardia, and risk for complications of hypoxemia. And that is all with the body temperature of a patient. Thank you.